I I am the Executive Director of Maternal Mental Health Leadership Alliance on behalf of all of the MMHLA team who you see with the purple backgrounds. Welcome to our All Advocate training. So we have a lovely PowerPoint to guide our discussion today. We're going to go over the high points of both the policies that we're going to be advocating for, as well as the details of Advocacy Day, and then give you an opportunity to meet individually in your small teams. So let's get started. I also want to welcome our two partner organizations, Mocha Moms Inc. and Postpartum Support International. So thrilled that they are helping out with our important Advocacy Day. Okay, next slide, please. So a couple of housekeeping things before we get started. Please go ahead and update your name and your state's abbreviation. Feel free to add your pronouns if you wish. Keep yourself on mute if you're not speaking, especially, if you're in carpool and you're like me, my kids would, let the dog out of the car. It was always chaotic. If you have to move around, please turn off your camera, and any questions, go ahead and drop them in the chat and we'll be monitoring all of that. Next slide, please. So just a little about Maternal Mental Health Leadership Alliance. If you are with us for the first time, we are a nonpartisan 501c3 nonprofit dedicated to improving the mental health of mothers and childbearing people in the United States by focusing primarily on national policy and bringing a health equity lens to all that we do. And again, a quick wave of hands from everybody from the MMHLA team. We've got Jamie, our policy director and founder, Mara Child, our operations and strategy director, Mia Hempstead, our senior communications manager, Amina Balagan, who is our project manager. We have a couple of board members with us, Meredith McCurry-Webb and Amy Danielson, who come to all of our advocacy events. Next slide, please. And at this point, I think, so there, sorry, I forgot to say next slide. There's everybody. Also, Maureen Johnson, who's one of our interns, Allison Meisler, who's been with us for many years as our research associate, and Emily Rosenberg, who, everybody, please give it up for Emily, the person behind the scenes, organizing all of this, setting up all of the meetings, doing all the hard work behind the scenes. Okay, next slide, please. And as I said, we have two board members who are with us, Amy Danielson and Meredith McCurry-Webb. And at this point, I am going to turn it over to Wendy Davis from Postpartum Support International to say a quick hello on behalf of PSI.
That's me. Hi, over here. I'm Wendy Davis. I'm President and CEO of Postpartum Support International, and I thank you for the opportunity to just say hello and express my gratitude, especially to MMHLA, but to all of you. And I am one of the things that we work hard, diligently, and consistently on is the unification of the voice of perinatal mental health, especially in advocacy. So being able to be a sister organization or sibling organization with MMHLA is really important to the work, to all of us. And as the legislators say to us, and we're saying to you, we can't do it without you. No laws are made, no bills are passed, nothing is known unless they're really hearing from the voice of lived experience. So we're just honored to be part of this. I know that there are, because of collaboration with MMHLA and our wonderful PSI chapters team, there are 18 advocates here, and probably you'll collect more from PSI chapters, including advocacy leads from the chapters, and we always say about help seekers, PSI does, no matter what door you come in, you will get the help you need. And I'm saying it too to advocates and members and ambassadors and cheerleaders of this cause. No matter what organization you work with, no matter what door you come in or what you have, what affiliation you have, your message is gonna get to the right place, much to the work, thanks to the work of MMHLA and their collaborative work with PSI and the Policy Center as well. And all of the other community groups that you've been really successful at working with, but especially because you got the ear of the folks on the Hill. And we thank you so much for that. So thank you and welcome.
Thanks, Wendy. So great to have you with us, and all the PSI folks, really thrilled to have you. That's what true partnership is, really showing up and help supporting each other. And so thank all of you for taking time, not only from your busy days today, again, many of you in carpool, children, work, the whole thing. Thanks for being with us today and for taking the time on Wednesday. We know it's a huge commitment, but our voices are so needed to talk with our elected officials to advocate for funding for important maternal mental health programs. Okay, so here's what we're going to go over today. A quick review of Maternal Mental Health 101, just so we're all on the same page. Our policy discussion, some meeting logistics, a discussion about how to craft your story, because that is so, so important. Some Q&A, and then team breakouts and next steps. Okay, so next slide, please. At this point, I am going to turn it over to MMHLA's founder and now Director of Policies, Jamie Belcito, who has been doing Advocacy Day since, I don't know, maybe you were like 15. Like, this is just Jamie's bread and butter. So take it away, my friend.
Thank you so much. Thrilled to have everyone here today, Wendy. Love your words. This is all about the power of our voices, of our lived experiences, coming together, keeping a focus on maternal mental health, and doing this in the best of partnerships and truly friends. I did want to just say, I don't know how I did this, but I drew on my screen. I don't know what that is, but we're just going to ignore and hopefully it's not distracting. And I am going to be the one pressing the button behind the scenes here, and will walk us through what Maternal Mental Health 101 is. And this is a primer, friends. I also wanted to mention before we get into this, in the chat, I just put the link to our private page, of which thank you to Mia Hempstead for doing such a great job. That has all the information that we need for our Advocacy Day, and something you can refer to during the training as well. So as we all know, those of us who have worked in this space for the time that we have, and those newcomers, that maternal mental health conditions are a range. It's a spectrum. It is not just, feeling sad. It's depression, anxiety disorders, obsessive compulsive disorder. I can speak up close and personal to that one. PTSD, bipolar, psychosis, and comorbidities with substance use. So when we think about what are postpartum depression, it isn't just depression. It isn't just one iteration, one specific feeling. It's an iterative range of conditions. 1 in 5 mothers are impacted by maternal mental health conditions, and that's during pregnancy and post. An average of 800,000 families are affected by this, friends. That's why we're here today doing this work, getting ready for an impactful Advocacy Day. Mental health conditions are the leading cause of maternal deaths in this country, and that is within the first year following pregnancy. These are temporary and treatable conditions and are hopefully, in my estimation, 100% preventable. $14 billion, that's the average cost that these temporary and treatable and preventable conditions cost the country, and that was in 2019. Most individuals are untreated, increase of risk of negative impacts on families, on the mom, on babies, for 75% of individuals that remain untreated. And that's for individuals who remain untreated. That's an incredible loss of time for the family. And this is something that we need to be educating at every point we can about maternal mental health conditions. Certain individuals are at increased risk for experiencing maternal mental health conditions. Some high-risk groups include people of color, individuals impacted by poverty, women with disabilities, and military service members and their spouses. When we take a look at the military and veterans portion of these figures, military mothers, active duty, and the dependents of, and retirees, 2 to 3 times experience maternal mental health conditions, 2 to 3 times higher rate than civilian counterparts. 36% of female active duty, military, and spouses will experience a maternal mental health condition. 60% of retired service members experience maternal mental health conditions. I'm going to give a policy overview. I also want to just say, if I am, going through these slides and they seem a bit quick, please know they will be available after today. We will have the recording up and you can revisit these slides, and the information we're going through today is also available on our private portal through Advocacy Day. We are advocating on this 2024 Advocacy Day for funding and legislation to support the maternal mental health of our nation's mothers. 3 points here. 1, continue to fund the National Maternal Mental Health Hotline at the full $10 million that was originally requested. It's an incredible experience to have seen this line come to life. And we understand that over 30,000 families and mothers have been able to find help through this National Maternal Mental Health Hotline. Number 2, fund the maternal mental health and substance use disorder programs for the full $24 million. Last year, some folks may remember there were some asks that were a little bit obscure on how much we were requesting. This year, we're going for it. We are requesting the full $24 million. And number 3, co-sponsoring the Maintaining Our Obligation to Moms Who Serve Act, short version, MOMS Act. And you'll see the House resolution number, that's for the House of Representatives, 7087. And for the Senate, that's 3641. The Maternal Mental Health Hotline, why additional funding matters. This hotline will be used to train hotline counselors on best practices to support the unique needs of service members, veterans, and military families using the hotline. And it will also give us the ability to create a public awareness campaign to reach more pregnant and postpartum women and birthing people. That's on top of the numbers that I just referenced, which are approximately 30,000 families that have been able to use this amazing hotline. Maternal mental health and substance use disorder programs. Why does the funding matter for this? It is going to continue to fund the existing 12 state programs. It will enable additional new state-based programs. Coordination of existing programs and technical assistance for non-grantee states. Public awareness, another key piece of what we're all continually working on, and that's education and public awareness of maternal mental health. And we'll also fund programs that address disparities in substance use issues for mothers and birthing people, which we know are such a large part of this subject matter. Here are states that are currently receiving funding for fiscal year 2023. 12 states right here. Some of them received funding prior. Some of them are receiving funding for the first time. And just a little FYI, we've put in a request to find out just how many states did apply for these fundings so that we can understand the high need that is out there for states looking to address their maternal mental health and substance use disorder issues in their states. And the third part of our Advocacy Day is the MOMS Act of 2024. This act will create a 5-year pilot program, 5-year pilot project rather, funded at $5 million with the goal of preventing maternal mental health conditions among uniformed service members and military spouses. This is a very exciting opportunity for us to uplift our families and sisters in service. I am going to pass the baton to Emily Rosenberg of Center Road Solutions, who has been the most incredible partner in us moving forward on our Advocacy Day. And with no further ado, Emily, thank you so much.
You can go to the next slide. So great. So this is an overview of the schedule. So Wednesday, we're going to have a welcome meeting. This is completely optional. I know it's early for a lot of folks. It's going to be 10 a.m. Eastern. The Zoom link is going to be on all your agendas. And then meetings are going to be from 10:30 to 4 p.m. Eastern. Your meetings will not start until 10 a.m. your time. So, or I'm sorry, 9 a.m. your time. So Pacific meetings aren't going to start until 12 p.m. Eastern. And then Central Times is going to be 11 a.m. Eastern. So we made sure to be appropriate for that. And Alaska and Hawaii, they're not going to start till 2 p.m. Eastern. And then 4 p.m. Are we having a? Is that okay? So 4 p.m. to 5 p.m. at ZB back in the breakout room. So we're having a breakout room open all throughout Advocacy Day. Feel free to pop in whenever. We're going to be, the MMHLA team is going to be in there. We'd love for you to share your experiences, ask any questions. We're going to have some music playing. Just a really lively, sort of energetic sort of day, and as well as the welcome meeting. It's just a little rah to get everyone excited for our meetings for the day. Next slide. Meeting attendance. So as we'll see on the next slide, all advocates are to attend all the meetings that are scheduled on your agendas. So you'll see that some people are just, there's only one constituent for the meeting. We still want the full team to be present for those meetings, just so they have support from the whole team members. This will be sort of more clear when you go to the next slide, Jamie. So as you can see, I apologize, it's not the best, but your agendas are on the website now, your tentative agendas. So you have my contact information. If there's any technical difficulties, a late staffer, any other issues, my cell phone number and my email, the break room information, and then all your team informations. Your team leader is highlighted in yellow and everyone's emails. There's a section for post-meeting summary. After each meeting, we like for you guys to fill out a meeting summary. The team leaders, you can go ahead and assign one person for each meeting to fill out those forms. We only need one person to fill out the form for each meeting. These really help us with personalized outreach to the staffers after the Advocacy Day. So we take care of all the follow emails. You don't have to worry about that. If there's any questions that the staffer has, please don't feel like you have to answer that. Just write it down and say, we'll bring this back to our team, and they'll reach out to you after Advocacy Day, get back to you with that answer. And then shifting over to the second image with the schedule. So you have your member of Congress, you have the staffer email, and you have the constituent. So like I was sharing, so this team, for example, is an Alaska and a Hawaii team. So for the first meeting for the Alaska, Sarah is the constituent, but we still want the individual from Hawaii to attend those meetings, and vice versa. We still want the Alaska advocate to attend the Hawaii meeting. So even if you don't see your name in that constituent box, please attend all the meetings. If there is something that pops up, please let your team leader know, as well as me, so we can sort of discuss alternative plans if we need to restructure things. So please just communicate that with your team leader as well as me. And then a Zoom link will be provided as well. You simply just have to click it and you're right into the room. So we make it nice and simple for you guys. Next slide. And then, so this is just an overview. The team leader should use video, but advocates, if you prefer not to, that's totally up to you. If you don't feel comfortable, you can keep yourself off of camera. We aim for the meetings to be 30 minutes. They are a free account, so you will be booted off after 40 minutes. Staffers, some of the meetings, staffers are limited to 15 to 20 minutes. They were kind enough to squeeze into their busy schedules. So some of them will be short meetings. But some might be kind enough to give us the full 30. So just be mindful of that. Don't arrive too early or don't stay too late. A third of the congressional staff will use video, but 2/3 will just have a photo or call in. So it's a mixed bag if they'll be on camera or on phone. And next slide. And then I have sent all of the staffers a one-pager that is on the website prior to the meeting. So when the team leaders, when you start your meetings, you can ask the staffer to pull that up to reference that when you're talking about the ask, if that's helpful for them. Next slide. And I'm gonna pass it back to Jamie. Feel free to pop any questions into the chat and I can answer them in chat, or we can talk through during the Q&A later.
Thank you so much, Emily. This is so helpful to see the flow of the actual meetings and how to access the links, etc. So just a little cheat sheet, so to speak, reference point for what these 30-minute meetings can look like or should look like, and at least give you some guidance. They'll ebb and flow and probably be different for each meeting, but this at least sets the stage. Introductions, the team lead will take that introduction piece on, wait for everyone to log on, and then start with the, thanks to the congressional office for meeting with us, and then allow everyone to go across through the Zoom room for introductions, where they're coming from. I just been thinking to myself originally doing this, I said, I'm a mom with lived experience. I'm the founder of the MMHLA. You can write down, here's what I always use, like my little cheat sheets, my index cards, kind of write down how you want to be identified. We will then have the Maternal Mental Health 101, the facts and figures that are available on the one pager. And then I already referenced the thanks, which I maybe snuck in a little bit earlier, but honestly, it won't make a difference if you say it in the first or second piece here. 2 advocate stories, again, applicable to however your group is comprised, averaging 6 to 10 minutes here. This is where things can maybe get a little long, and that absolutely makes sense when an individual's sharing their personal story, of which we have the incredible Chanel Jones of New York, who's going to help us craft those stories. We want to keep it tied into our policy asks and keep that time frame 6 to 10 minutes, assuming that we have 2 stories to be told. Advocacy Day asks 5 to 10 minutes. And again, it's the 1, 2, 3 we just went through. We want to fund the National Maternal Mental Health Hotline at 10 million. We want to continue to fund those state grants, but we want the full 24 million for fiscal year 2025. And we are asking for co-sponsorship for the Moms Act. When you're speaking to the House of Representatives, it's HR 7087, Senate 3641. And truth be told, it's on the one pager. The congressional staffer will have it. They'll know which bill they're supposed to be looking at, so you can say both, and that's fine. Question and answers, 2 minutes. I will say this: if congressional staff has questions that you might not, have the answer right away, or you say to yourself, oh my gosh, I know I should have that answer, take a look at the one pager. If you don't, just say, hey, these are great. May I ask, could you email, I'm going to say the constituent, but Emily, should it be best for if they just email me?
Yes, I believe your contact should be on the one pager.
That's right. It is.
Yeah. Yeah.
Okay. Have them talk to me, folks. Send them my way. I'm more than happy to answer those questions. You know, you guys are doing the hard work by getting into these meetings and having these discussions. And really the biggest part of this is that we want these offices to understand that that maternal mental health issues are affecting their constituents, and that there's an opportunity to actually help them by way of the programs we're talking about here. Then debrief. After the staffer leaves the call, hang out with your team, and there will be one person, you know, so you can kind of debrief. Oh my gosh, what'd you think? Did that go well? Yeah, that was spot on. Great. We got a little bit of a groove going. Whatever that discussion looks like. And then it says select one person on the team to fill out the post-meeting Google form. Emily, do you mind speaking quickly on the post-meeting Google form?
Yeah, so the Google form is going to be on your agenda. It will be at the bottom after the box that has all your meetings. Just select one person to fill that out. It's very short, just asking to summarize how your meeting went. Just your sense of, do you feel like they're going to be supportive of our advocacy to ask, did they have any questions? And then just writing some of the questions that they had, and then put in the staffer's name. That really helps us with the follow-up email that I'll do after Advocacy Day.
Thank you so much. And here's a little bit more of a deep dive into the 5-minute debrief. I'm always thinking, chatty Cathy like me, you know, do you run out of time? If that's the case, the team can leave the meeting and reopen that meeting to restart, but you can also go into the break room, and we will have someone on our open Zoom that can bring that group into a break room as well. And that will be all day. Friendly reminders, you know, try to stay high level. We put this out here because we've got such a short amount of time, and the stories and the individuals and the passion we're bringing, I think we could all speak for so long individually on our experiences. And for the intent and purpose of this, we're going to use the stats that are on that one pager. We're going to, again, Chanel's going to walk us through how to make that impactful personal story, that personal statement. We're going to keep a focus on the 3 policy asks for this advocacy day. Throwing in the nonpartisan piece, I will be very frank in saying sometimes, I'm just putting this out here, there will be a question about reproductive rights that gets baked into this. That's not what we're talking about. We're talking about supporting pregnant and birthing people wherever they are in that journey. So if something comes up like that, you can just pivot back. Thank you for the question. We're here to talk about the grants, the hotline, and the Moms Act. Dress code. I wore a little bling bling today. I have some jewelry on underneath, you know, little suit jacket. That's my vibe. Business on the top, party on the bottom. You want to wear your comfy, you know, fleecy duck jammies, whatever you got going on. That's great. Just making sure that we're keeping it a little bit business on the top. I did want to say I was going to wear purple. That's not going to work out with the great purple background. So be mindful of my purple folks who love that color. We want to make sure that it doesn't blend in like a little green screen. Zoom background. I have this background here, of which, again, thank you, Mia Hempstead, for building this out. It is available on our private Advocacy Day page, and you can download it. If by chance it doesn't work out, totally fine. If you can use the blur, and it should be on the stop video with the little caret, you can hit on that and it will go to blur video. And I actually think you can do that in anticipation of getting on the meetings themselves. Any questions? Can pop them right into the chat. Or not even that. Oh my gosh, Heather, green marquees, like my hair and glasses are purple. Let's see how it goes. I see you. I see you.
Well, thank you, Jamie and Emily, for all of that information. I know it's a lot. Please make sure to check out the Advocacy Day private page. Everything is on there. The slides from this presentation will be posted there, but the one pager is there. The agenda for each meeting that Jamie walked through is there. And so anything that you need is on that private page. Okay, we are getting set now to hear from an advocate who will help tell her story and teach you all how to tell your story. The personal stories are some of the most impactful things that we can share to help educate our elected officials and their staffs about these issues. We say that effective advocacy includes moving both the hearts and the minds. And so moving the heart is the stories, right? Why we do this work, maybe because of our personal experience or the clients that we see or a loved one. And then the facts are what move people's minds. And so really it's this combination of facts and personal stories that really make a difference. So I am delighted to introduce Chanel Jones, who is a doula and a childbirth educator who lives in Suffolk County, New York, which is right outside New York City. So she's on Long Island. Chanel has been part of MMHLA's Board of Advisors for the last 4 years or so. And little known fact, Chanel, I went back to my notes when we first met. She was a backup singer for gospel singer Yolanda Adams. So there you go, little known fact about Chanel. So please welcome Chanel to the stage. And she is going to talk about what does it mean to tell your story, share her story, and help each of us figure out the best ways to tell our story. So thank you.
Thank you so much.
Oh, so good to see you.
No pressure or anything like that. That
Maybe
was a really fun
you
event, actually.
you could sing this for us.
I could put it in song.
Yeah,
So
there you
what
go.
does it mean to start? I'm kidding. So no, thank you so much. I'm so honored to be asked to present this portion of the slide. Storytelling is such an integral part of what we're doing to convey a message of, in order to effectively have change in this country. So thank you so much. And I'm gonna be mindful of the time. What does it mean to tell your story? Who are you sharing your story with? I mean, we're not sharing it with your average Joe, right? But at the same time, there are people just like you and me at the end of the day. And so it's just important to, yes, we are coming here with the focus of the purpose is this vision, this mission that we have, right? To tell our stories so that we can get the funding that we need for the state maternal mental health and substance use disorder programs, for the funding for the National Maternal Mental Health Hotline, and also for our Moms Act, right? These things are so important, but we're telling a story here. We're not just meeting with people. We don't have to be robotic. There's no, there's no, I don't want to say there's no wrong way to do it, but we're gonna move on to the next slide. Let me dig a little further so you guys understand what I mean. You can go to, yes, perfect. So how to harness the power of telling your story, right? Of storytelling. There are some key components to telling a great story. It should be captivating. It should be relatable, imaginary, concise. Like there should be imagery, right? You think when you tell a story, you kind of want to live the experience with the person while they're telling it. So that's what I think of when I think of awesome storytelling. And so some of the misconceptions about storytelling is like that it has to have perfect wording, right? It's not so much perfect wording, it's more so what you're saying and how you're saying it, right? It doesn't have to be a happy ending. We don't all have happy endings to our stories. So it's okay if it's imperfect, if it's not the Hollywood, fairy tale, story of your life. That's okay. It's real. We're here to be real. We're here to pour out our hearts so that people can see what we've also had to deal with on our day-to-day living. And crying is okay. Crying is not unprofessional. We're normal, everyday people that they're supposed to be representing. And so I say, if it's bruised, touch it. Touch it and back off it. You know what I mean? But like, we're real, so we're allowed to feel our feelings, and they're allowed to see that vulnerability. Because personally, if someone is crying, like, it moves me to tears because that person allowed me to experience something with them. So great storytelling is all those things. It's captivating, it's concise, right? This is what we're going to talk about today. Like, you can tell a story and you can be concise and sad and funny and emotional and vulnerable and mission centered. So why are we telling this story? It's for a purpose, right? So let's never lose sight of the vision. And we're here so that people can also, you know, feel that. So if you want to move on to the next slide, I wanted to give you a couple of examples, right? So we have examples of storytelling. Sometimes when we're telling a story, we ramble, we're super nervous, right? And so we kind of get lost in our thoughts, and it's easy to just ramble. I'll give you an example. I'll try to stay away from like some personal stories I've heard, but just say you're rambling about your day, like, oh, I went to go do this thing, and this guy came, and then I don't know, the sky was kind of blue, and then but yeah, and so back to my story, and you know, like, we do these kind of like ramblings, getting lost in the story kind of thing. And we don't want that, because we have 3 minutes or less to be super purposeful and intentional, right? So we want to encourage you to write down what it is. Like, what I like to do is write down my story, and then side by side put the bullet points of our mission, and like what parts of my own personal story, right, kind of hit the bullet points of our mission. And that helps me kind of bring my focus in, right? And then sometimes when we tell our stories, we get super emotional. And so I'm going to ask for a volunteer from our panel, and I'm going to give an example, okay? I'll just talk about my cat, right? So I had this cat, and I really needed her to go to the vet. I just didn't have enough money.
That's okay, Chanel. It's a lot for you to be trying to process this right now. If you want to just take a moment.
Thank you. Thank you. And so I did that example, and thank you. I did that example because sometimes when people get overwhelmed, you don't know what to do. It's like this big pause. And this is also for the team leads. Sometimes it's okay to let people feel their feelings and to jump in and say, like, hey, you know, thank you for your moment of vulnerability, and then kind of take over and bring it back to the mission, right? Because first off, we applaud that person for trying to tell their story, right? Because every time you tell your story, it's a healing process. So we do want to allow for that. Again, we're people, we're human. We're not robots. And it's okay for leaders to jump in and kind of bring us back to the focus. So I just wanted to, when you're overwhelmed, if you can't regain your focus, it's okay for leaders to jump in to help bring us back. So I just wanted to make sure that first, you're not afraid to cry, because you absolutely can. It's a safe space. And leaders, I want you to feel empowered to kind of like hold space for that person, but then also, you know, okay, we're going to bring it back to, you know, thank you so much. You don't have to finish at this point in time, because, you know, that was enough for me, you know, like, bring it back, right? And so, and then for the focus centered storytelling, it's got to have at least one mention of, if I had that hotline, man, what a difference it would have made. Or you know, I saw my sister suffering with her addiction to drugs, and I really wish there were more programs out there for her. You know, because we're not just telling our stories, we could be telling somebody else's story and how it impacted us. And so just bringing it back to the mission, right? I personally like to add a little comedy to my vulnerable moments, where I find myself getting choked up and emotional and moved, and I'll think about something silly in that moment that kind of brings me back, right? But it also allows me to be vulnerable. And then if you can touch on bullet points throughout your story, yes. And if not, then always at the end, at least mention one of the 3 focus points for this year's Advocacy Day. So practice, find your flow. switch it up, it should feel natural. It shouldn't feel forced. Like as if you're talking to one of your friends. So those are my key, what I try to keep in mind when I'm storytelling. And honestly, I tell my story and it's never the same every time I tell it because I want it to flow naturally. And I know the stuff that's most impactful to me and to the mission. And so I know as long as I hit those key things, that's important. And then it gives you kind of liberty to explore your story. But do this a lot. And then this way, when you get in front of your Politicians for Advocacy Day, it'll just feel free flowing and you won't feel that amount of pressure to be perfect, right? So we can move on to the next slide. I'm going to tell my story and I'm going to attempt to do it in the time that was allotted. And feel free to look at the pictures while I tell my story. This is my beautiful daughter, Michaela Antoinette. I love her so much. She's 15 now. And she is just the apple of my eye. So I'm going to begin. And I'm going to do it as if I'm talking to a politician so you can kind of feel how that would flow. And so thank you so much, sir, madam, for your time. I really appreciate you giving me this opportunity to share my story. And so my story begins when I was at the ripe age of 20, going on 21, my junior year of college. I got pregnant unexpectedly and I was by myself and I just was so excited to become a mom. And I just took the opportunity to be positive. I had a great pregnancy, no complications, really. I mean, I could have stayed pregnant forever. I was eating for 2 on the campus, and so I was living my dream until I carried her an extra 2 weeks over and things got a little messy. And so the day before I was going to be induced, the doctor, my water broke. And the doctors gave me 24 hours to push her out naturally because I knew I wanted a natural birth, but I didn't have a doula at the time. And I had nobody to advocate for me. And so they just laid me on my back for 24 hours straight. And so after 24 hours on my back, you can imagine I ended up in a C-section. And luckily I was able to breastfeed her right away. I wouldn't even let them pull me into recovery room without putting her on. She latched right away. It was beautiful. I cried. It hurt. It was great. And but when it came time to discharge me, they let me leave about 3 hours before my 3-day mark. And so they let me leave with a low-grade fever. I didn't know. And so I ended up back in the hospital 3 hours later with a double lung infection of pneumonia, and I was septic due to the C-section and the meconium. And so I was arguing with my kid's father at the time. We were not together. And so I had no one to take my kid because they couldn't admit me back to mother baby. It was summer. There was no room. And so they stuck me on a sick children's ward and they said, if you don't get someone to come get her, we're calling CPS. And so my mom drove overnight, bless her soul. And she came and got my baby. But they didn't think, I always tell people I almost died twice. They didn't think I was going to make it through the night. That's how bad it was. They had me on all the antibiotics in the world. But I did survive, thank God. And then I was in the hospital for like 4 more days, separated from my daughter. So my breast got engorged. I was pumping out bloody breast milk. And I developed white coat syndrome, which caused me to have high blood pressure every time I saw a doctor. And then one day it was so bad. And I was just like, if you don't let me leave this hospital, I'm going to die here. Like, just send me home so I can be with my baby. And I'm so glad that I did, because I went home and I dropped all the extra water weight. My blood pressure went down and I was able to see my daughter. But there was a lot of trauma. And I eventually developed intrusive thoughts where I thought, oh, maybe I'll just stick my baby in the oven. Like, why would I stick my baby in the oven? Or I'm bathing her. Why would I let her slip under the water? And I had these intrusive thoughts. And every time I went to the doctor's office and they asked me if I was okay, I'm like, yeah, I'm okay. Because I didn't want them to take my baby. But I had intrusive thoughts. I had postpartum depression, really bad, just isolated and not really having someone to talk to. And honestly, I just got so bad to the point where I just made a decision that this baby didn't ask to be here and I needed to get help for myself. And I started seeing a therapist and I started making the right connections. But that's me. That's my story. And I'm so grateful because my daughter literally saved my life. Me looking at her, telling her that she didn't ask to be here and I got to get it together, literally took me up from a deep, dark place. And I'm so grateful. But I hear so many stories of moms who didn't have that opportunity. And so I'm telling you today, these bills that we're asking for you to sponsor, to donate, to approve, they're going to make such a difference in the lives of the women who suffer in silence. And so we're asking you today to give us your yes, so that nobody else has to suffer the way that I did and any other woman should. Thank you. And so that's my story. And so I thank you so much for your time. You can go down to the next slide. And so for everyone else, the main takeaways, right, is that your story should bring us on a journey with you. You should want to laugh and cry and rejoice. And at the end of the day, all of our stories, we find ourselves advocating for both past and present experience and the future experiences of people in this country, that they might be able to tell a different story about how the help was there right from the start and they didn't have to suffer in silence, and that we can make a difference by having these hotlines, by having these programs in place, and making sure the women who are protecting and serving this country are getting the support that they need. And so for what to expect for Advocacy Day is that 2 to 3 people should share their stories per meeting. You want to have 3 minutes or less. I mean, you have 3 to 5 minutes, just depending. But you can share stories of your friends or family. And if you don't want to share your story, you can share your story in the breakout room and maybe ask someone to share it for you, but you could talk to your team lead about that, or maybe you're just there in your presence. So that's the end of my presentation. I hope you guys liked it. Thank you so much.
Oh my gosh, Chanel, you are amazing. Amazing. Thank you for sharing your story and also for walking us through all of that. And I'm sorry that you had such a tough time when your daughter was born, and I'm so glad that she pulled you out of it. So I had tears in my eyes. So you pulled at the heartstrings. So thank you for doing all of that. And I see thank yous in the chat. That really was quite amazing. So grateful, Chanel, that you're with us today. So just a couple of things I want to point out. I think one of the slides said earlier that, you know, your staffer that you're talking to may or may not be on camera. Capitol Hill staffers, congressional staffers tend to be younger than we might think. And it's okay. These are super smart people. They have a lot of influence with their members of Congress. They may or may not be on camera. They may or may not know how to respond to your story, but just go ahead and tell it. Talk, you know, these are important pieces of information. They'll have the one pager that they can take notes on. And, you know, you may have some members participate, but most likely it will be staffers. And some of them are young mothers themselves, and they may, you know, also share their stories, which has been kind of a unique aspect of this. And, you know, and that's one of the things that I say to people, like I think back to our first Advocacy Day, and, you know, we're meeting with this young man, and I could tell he like wasn't getting this at all. And I was like, how am I going to connect with this young guy? And I was finding like, hey, you have a mom, a grandmother, a sister, a friend, a neighbor, a coworker, somebody you know 5 women. One of them is going to have a baby and they're going to have postpartum depression. And you might be the one who helps them. And so I really tried to connect with him kind of one-on-one. And so, you know, just think about that. You know, some of these people will be very, very engaged. Others may be kind of like, yeah. Don't worry, keep talking, get your message across. We'll follow up, make sure we answer their questions. So yeah, all set there. Okay, so we have an opportunity for any questions before we move into our breakout rooms. Again, all the information is on our private page. So any questions that you may have, you can find the information there. Should we prepare a slide? No. Well, You know, you could if you wanted to. That's a great question, Brittany. Like, it was great to see Chanel slide and her daughter. We've never done that before, but sure, give it a try, see how it goes. Yeah. I think that's a great idea. All right.
I will.
Yeah, James, what's up?
Thanks so much. I just wanted to also add this, and Chanel, again, I said to you before, we got to meet in New York. Now that I just heard your story, I'd really like for us to connect, and our stories don't leave us. I did also want to say, I had mentioned the power of the index card. You can't even see it because it's white, and I have a drop, this purple background that you can't see. But even just writing down the triggers and the traumas, just, this is my name, I'm your constituent, this is where I had my baby, there were no supports. It really would have been helpful if I had XYZ. You can just even just bum.
Yeah.
And I will also say this, you will have these folks' contact information that you can follow up if you have something. Some women have written their story, to share, and in the poeticism of what we just heard, and the bravery there, just know it can come in all forms. So just wanted to put that out there. Thank you.
And I'm looking at a question in the chat from Angelica, and she talks about that she had really severe postpartum depression, that she was miserable. You had no support. And you know what, Angelica, tell that story and say, hey, you know what? If there had been this maternal mental health hotline, I could have texted somebody or talked to somebody in the middle of the night, or, however you want to explain this. And you're right. Some of these situations are very situational, right? I mean, when I had postpartum depression, 22 years ago, it was very situational. I had a very scary emergency C-section. My son would have died if we weren't in the hospital. I was sleep deprived. I had a toddler and a newborn. I couldn't get my act together. Like, it was very, very situational. So I think you can say that as well. Like, where part of our job is helping to educate these staff members about the many manifestations of these mental health conditions. So yeah, I think you can say exactly right. And even many of us feel this. We hated having a newborn, right? We didn't hate our baby, but we hated that time in life because it was so darn hard, especially if you're anxious or overwhelmed or depressed. I think it's okay to say that and be like, you know what? I wanted this baby. And then I found myself in this situation, and here's what could have helped. I could have had access to this program. I could have had access to this hotline. If I'm a military mom, right, I could have had these supports. So yeah, I think all is fair game. All right, we got any other questions?
And again, feel free to reach out post this session if anything comes up.
Yeah. And everybody's experience is different. So however you experienced your particular story is completely valid. You shouldn't feel embarrassed or like you can't talk about these things because it's your truth. Yeah. Okay, so we are going to just go over a few last minute details, and then we're going to go into our breakout rooms. So again, all of the Advocacy Day materials are on the private webpage. Everything you need there, the one pager for the congressional offices. And that one pager is basically your talking points, right? It's got the facts and figures about maternal mental health. It's got the specific asks. So you can just use that as your talking points. Also listed under are the retraining recordings, the presentation slides, any information that you need. This is also where you're going to find your agendas. And they'll click through and you'll get the beautiful agenda that Emily's been talking about and putting together that lists the different meetings that you're going to be having, the Zoom links, everything you need to know. The link to the Advocacy Day virtual meeting room is there, so you can pop in. We'll be in that room all day on Wednesday. Somebody will be there. Hop back in. It's just like if we were on Capitol Hill. It would be like the holding room. You come back after your meetings, right? Sit down, take your high heels off, have a cup of coffee, whatever. So we'll be there. Download the virtual background. If you need any help with figuring out how to download or upload that, we can do that. There's also some frequently asked questions, everything you need to know there. Okay, team. Have we covered everything? Is there anything we haven't gone over.
I have one thing that I did want to add in here, and thank you so much, Adrian. I did just want to acknowledge Danye
Yes.
Iker from Mocha Moms, who's joined us. And Danye, I don't know if you are able to say hello. She indicated that she is in an internet challenged area.
In a hotel room. Hi, everyone.
Hi!
So much. Chanel, can I just say how much your story touched me? As a mom and as a human and as a communications professional, how excellent and well done it was. So thank you so much for that. And we're looking forward to being here. Jamie, I don't know if you saw my question. I am curious about, and Adrian or anyone else can answer the question. I saw that someone posted that postpartum is postpartum. And I'm wondering about the value of talking about the depression that happens, like not within the first year of being a mom, but even much later. So many of our moms do experience postpartum depression within that first year or around the time of birth, but others, because our moms tend to be very high achieving and really, really focused, a lot of top A personalities across the country in Mocha Moms. And I think in part culturally, right, mental health is just not something that we're accustomed to talking about. And so we are very accustomed to taking care of all the things and doing all the things, and then end up struggling, not being able to name where they are. And we've talked about this as a group, right? Where we are, what we're feeling, why we're so tired, and the ways in which sometimes tired is not about not getting enough rest. And so I'm wondering if there's any value of raising that, sharing that story as well for moms.
Absolutely. I think whatever way you have brings you to this event and to the table here and to want to advocate for these issues, I think it's valid to talk about all of those things, and like you said, like sometimes, and so for many, many years, for about 10 years, I ran support groups for new moms who had maternal mental health complications. And I would say, this idea of, like you said, type A, got it together, overachieving, could handle anything, right? Like almost like the higher you climb, the harder you fall sometimes, right? And I remember this one mom who came in and she's like, I don't know why I can't handle everything like I used to. And I'm like, so tell me what's gone on in your life over the last year. And it was like her father had been diagnosed with cancer and passed away. She was pregnant with twins. Her husband lost his job. They moved cross country. They bought a new house. It's like every possible stressor in life. And she's like, but I used to be able to handle everything. And now I can barely see straight. I'm like, because you just named like the 10 top stressors in life that you've experienced. She's like, oh, really? Like we're so conditioned to just keep going, keep marching, especially if you're a military mom. You just keep doing, right? And like you said, we take care of everything. We take care of the home, the dog, the garbage, the husband, the house, the kids, the cleaning, the work, everything that we can't see what is happening to us sometimes. And so I'm being awfully long-winded, but just to go back, Danye, whatever brings you to the table today is the story that you should share, for sure, for sure.
Thank you so much. And thank all of you for your comments in the chat and supporting that exploration.
Yeah, so great to see everybody today. Okay, matrescence. Yes, I love that term. Becoming a new mother is we experience more hormonal changes and life changes during and following pregnancy than we do in any other time in life except for adolescence, right? And we all can sort of cut teenagers some slack because we know they're going through adolescence. Well, the same thing needs to happen when we're talking about becoming a new mother, this term of matrescence. Okay, so I think we're ready to break out into our teams so we can get to know each other and to figure out who wants to tell their story when, and just, get to know each other before the big day on Wednesday. So yes, jump in. Somebody take it from here and tell me what's next.
I want to add one thing before we dive in, because I think this will help people with the breakouts.
Yeah.
Because I think the challenge is, if folks are trying to find a way to connect their story with, one of our policy asks. I think if they are thinking that the policy asks are strictly responding to clinical issues, or like Angelica so generously brought up, like, what if this was social factors and it wasn't like necessarily a hormonal thing, or I think it might be helpful for folks to understand maybe a little bit more about the maternal mental health and substance use disorder programs, that those are actually not just connecting people with like psychiatrists and therapists, but also those programs enable family physicians, obstetricians, gynecologists, when they see you, if you're struggling, can also connect you with support resources and support groups and things that are not necessarily trying to improve, right, just the clinical aspect of your mental health, but maybe even just the social support that you need. One of the things that helped me tremendously was having a weekly support group that somebody told me about in the community. And so I think if we can understand, or help everyone understand, just take a minute to explain, because Adrienne, you're really good at explaining the MMHSUD programs. Maybe they can see how, we need more states that have those programs. Only 12 of those states, there are only those programs in 12 states. And one of our policy asks this year is to fully fund it at 24 million so that more states can have it, right? Why is it that only some states get to have this increased maternal mental health capacity so that our family physicians, et cetera, can connect moms who are struggling to the right resources, regardless of however you landed into postpartum depression, right? It's not just if you had a traumatic birth, or if you, had intrusive thoughts, for instance. I experienced postpartum depression and I didn't have intrusive thoughts. It was a different path to me. So Adrienne, I don't know if you could take 30 seconds or a minute to just kind of touch on those programs and how people can connect their story to those programs as well.
Absolutely. Thanks for teeing it up, Mia. Yeah, so these psychiatry access programs, this is part of what we're advocating for funding for. So as Mia said, there are 12 states that receive federal funding. There's several more states that have programs in some nascent form, but they don't receive federal funding, right? So that's why we really are advocating for this 24 million so that more states can build up these programs. Here's how these programs work. Think about, we don't have enough psychiatrists to treat all the moms who might need help. So these very highly trained psychiatrists go out to primary care providers, so obstetricians, pediatricians, family physicians, other psychiatrists, and they teach them about maternal mental health conditions, how to screen their patients, how to treat sort of common signs of anxiety or depression. So that's the first thing. So it's this training for frontline providers. Secondly, they provide these frontline providers immediate access to psychiatrists for more complicated cases. So for example, if I'm the obstetrician and say Mia comes into my office and she's my patient and she's experiencing some symptoms that I don't know how to treat, I can call the online or the on-call psychiatrist and talk in real time and be like, hey, I have this patient in, here's her symptoms. What do I do? How do I treat this? And so there's this real-time teaching that happens. And then there's also connections for resources and referrals. So I can say to Mia, hey, you know what? They said that there's a therapist down the street who's accepting new patients, or there's a support group that meets at the local hospital. So those kinds of things. And so these programs provide several things. So it's that training for frontline providers. It's that immediate real-time support. And then it's the resources and referrals. So just to kind of give you an overview, I don't expect you to know all those details, but just so you can say, hey, if I had been in my OB's office and I told them I wasn't feeling well, they could have picked up the phone and called somebody and helped me, get on medication or connect with a resource or whatever. So I hope that helps a little bit. And again, looking at the breakout sessions, keep it simple. You don't have to go into all these details. That's our job. We'll follow up with people, answer their questions. We just need you to tell your stories and ask them to fund these important programs. So those are the two bottom lines. Tell the story, ask for funding. Okay, let's go into our breakout rooms because we have about 22 minutes left, and we are going to meet our teams and practice telling our stories. And then after your breakout session, when your team is done, you are free to go, or you can come back in here to the main room if you have any questions. All right, so who's going to work the magic? Oh, Emily is. Okay, inviting to join rooms. I'll see you on the other side.
Please do us a favor. If your name isn't reflected correctly, if you could just make sure it is, and also add your state, because some people might have signed in with a different name. We want to make sure that we send you to your correct state and breakout room. Thank you.